Hey, thank you everyone for taking the time to join us for our annual town hall. This session, as you heard, will be recorded and posted on YouTube. Uh, we do have an exciting agenda. Uh, we'll be talking about leadership, this pediatric to adult transition task force, upcoming webinar, exciting publication highlights, Boston, and standards and guidelines. So we all know that the ISHLT has become the most important organization in our fields, and I want to recognize and celebrate the tremendous impact that pediatric members and the pediatric community have had in ISHLT. Uh, Case in point, we have the pleasure and honor of having Dr. Christian Bendon here with us today. As you know, he is the current president of ISHLT and has previously served the ISHLT in many facets, the board of directors, as the scientific program chair and council chair, among others. He also happens to be a pediatrician, pulmonologist, and the director of lung transplant at Boston Children's Hospital. So, Dr. Bendon, can you share a few words with us?
Of course, David, pleasure. Thanks for asking me, to do that. As you just said, I'm a pediatric pulmonologist, so I would have ordinarily signed up for this meeting because it's, our professional community. So I think it's very important, but, I'm very happy to say a few words. And I fully concur what you said about the importance of peds, I think of pediatrics in ISHLT. Just reflecting by the fact that myself, as a pediatric pulmonologist, currently the president, and we had other pediatric, colleagues before with Laura Danziger-Isakov, an ILD physician, Stuart Sweet, obviously as a pulmonologist, Laurie West as a cardiologist. So that just shows how important this is. And even now the board, despite myself, it's Simon Urschel, who is a pediatric cardiologist in Edmonton, who is also on the board, and it's Martin Schweiger, who is a pediatric cardiac surgeon from the University Children's Hospital in Zurich. So really showing the strong pediatric, impact, and that has led to a lot of great things, involvement in for example, in the setup of guidelines and standard documents, always making sure that the pediatric voice is heard. And there are many exciting things happening. I'm so pleased. I just actually returned last night from Puerto Rico, where we had our board meeting and also the meeting of the Leadership Advisory Forum. It was a strategic meeting. We had an external facilitator, and you'll hear soon at the annual meeting about this, because we every 5 years look at our strategic plan, and it was great that we had a lot of pediatric input there as well, and it's really exciting. Then what you said, obviously now I'm sitting in Boston after I relocated last summer from Zurich to the United States, and I'm so excited that the meeting that I preside will be actually in Boston, so just around the corner behind our house, which is great. And just looking at the program, the content of the program, it's amazing. I mean, we had over 2,000 abstracts that were submitted, which is the highest number ever overall. So we expect an attendance of over 4,000 people, according to our previous metrics for North American meetings. And I think the people on the program committee, on the executive program committee, on the program committee have done an excellent job. It was Chesney and Sean for the heart group, and it was Nick Aftemiris for the lung group. It was Oliver from Germany for MCS, and then Maurice, from Switzerland for PVD. So also they're showing the international, broad, spectrum of ISHT involvement, having people from North America and outside, which is really exciting. And as you said, I'm also very pleased that there will be some great publications coming up in the journal, as you mentioned before. JHLT Open is having this exciting, pediatric edition coming up that I'm also very happy to co-chair together with my colleague Estella. She's a pediatric cardiologist in Sao Paulo in Brazil, once again showing the international view of ISHLT, and a lot of exciting topics, and also in JHLT coming up as well. So I think it's really great. So I just want to ask or invite everyone to come to Boston. There are great things, up for pediatrics. I think you will hear from Chesney, Sean, Nicholas, Oliver, and Maurice shortly. They will put something together so where you have really a condensed view of the pediatric content of the program, and that you all can really get excited. There's some great pre-meetings coming up as well. Most of them, unfortunately, already, I think, sold out and fully, booked. But it's great. So I really want to ask everyone to attend, but also to get involved whenever something is coming up. That's important, make your voice heard. And I think you, David, and the others on the leadership of the pediatric professional council, these are the right people to address issues to. And then just be sure that you get involved and put your hand up when there are jobs. Participation in all the different areas when they're coming up, and that's the most important thing. And there's a lot going on, and pediatrics is really great. And also the numbers for pediatrics group look great. I think it's a group that's actually expanding, even though we're a small community, obviously, but the numbers are expanding, which is fantastic. So that's all I want to say.
Oh, thank you so much, Dr. Benden, for your leadership. And I remember you giving me some of this very advice at a first timers breakfast at the annual meeting probably a decade ago, and just how welcoming and you were to me and others. Like, I think John may have been there at one of these introductory breakfasts. So yeah, it is really easy and fun to get involved. So thank you. I just wanted to briefly acknowledge and recognize our other diverse pediatric leaders from across the world. Dr. Bridget Williams, she's a pediatric pulmonologist from the Netherlands. Dr. Estela Azika, pediatric cardiologist from Brazil. Dr. Neha Bansal, a pediatric cardiologist from New York. Dr. Sean West, a pediatric cardiologist from Pittsburgh. And Dr. Fawaz Shah, pediatric cardiothoracic surgeon from Atlanta, Georgia. And I wanted to introduce and congratulate Dr. Bansal, who was selected to be our incoming pediatrics PC chair starting in May. So congrats to Neha. And next, I want to hand it off to Dr. Melissa Cousineau to share about one of ISHLT's most important and exciting endeavors. So take it away, Melissa.
Thanks so much, Dave. Just confirming you're all hearing me okay? Great. All right. Well, pleased to share an update from the ISHLT Pediatric to Adult Transition Task Force. This is a task force that has really come from, I think, the pediatrics community and advocacy with Dr. Benden and Dr. Urschel's leadership as president and our board of directors liaison, but I think excitingly has a lot of support from the adult community and ISHLT as well. So I will be sharing an update on what we've been working on. So just for all to know, I'm really honored to co-chair this task force along with Dr. Miranda Paraskeva. Miranda is an adult pulmonologist from Australia, but she actually takes care of adolescent patients as well. She's a fantastic colleague, and I've really, really loved working with her as we've been working with this task force. For most of you here, I think I know many of you, but I'm a pediatric psychologist at the University of Michigan. I work with Dave every day. So it's really nice to see that we have international representation, both pediatric and adult representation in the co-chair and leadership, but also multidisciplinary representation. I think as so many can appreciate, the challenges of transition are just as much psychological and social as they are medical. Next slide. So our task force charter, our overall goal is to define the challenges of our patients before and after transplantation, as well as advanced heart and lung therapies, and really work to improve outcomes around self-care, transition, and optimized management and support for our patients to improve their overall health and well-being. Our task force is comprised of 18 members. So we actually sent out a call for nominations as well as applications for this task force. We had over 50 applications across the ISHLT for this task force. So we really wanted to make sure it was open to ISHLT membership and had a really exciting response to the task force call for members. We then had the difficult task of selecting members, and it was really important, as is true to ISHLT committees, that it was diverse in terms of geography, in disciplines. We really wanted to make sure that we had excellent representation from the adult community as well. Certainly transition and transfer is not just a pediatric problem. So you can see here that 7 of our 18 members identify as a pediatric clinician, but another 5 of our members actually identify as clinicians that care for both adult and pediatric patients. We have 7 countries represented on this committee, so we are learning across our international community in terms of what is enabling better transition outcomes, et cetera, what types of programs people have across the country. And we also have a 50-50 heart-lung representation on the committee. Next slide. This is our committee here. You can see a number of our pediatrics community represented. We also have 4 nurses represented, 2 of which serve the pediatric patient community and 2 of which are adult transplant coordinators. So again, I think just a really nice multidisciplinary representation. We have a surgeon, we have Dr. Samantha Anthony, a social worker from Canada, myself as a psychologist. So we're really pleased with this incredibly expert and very engaged task force. Next slide. So what have we been working on? We've had about 4 to 5, I'm looking at Juliet and Chris, 4 to 5 task force committee meetings at this point. We've been meeting monthly, and we now have developed a number of working groups within the task force. And so as we were coming together, we found that this is one of the first opportunities in the transplant community to really engage, an international and multidisciplinary membership to really understand what are the current practices around transition and transfer around the globe. We saw from one of our colleagues from Spain, for example, a really exciting program that they're doing in Spain. And so we're really we want to first really learn, what ISHLT membership is doing. And then we also want to know from ISHLT membership what you all envision are the needs from this task force. So, we know that there are transition surveys that have already been developed. There are transition resources that have already been developed. And so this task force doesn't want to, create much of the same, but really move the needle forward, given that this is a problem that continues to linger for all of us and for our patients. And so we're working on a survey of membership that's going to be coming out soon. We also have some exciting conversations underway with the ISHLT Registry Committee. There are some limitations in the ISHLT Registry to really look at outcomes for the transition age or this adolescent to young adult age patient group. And so we are actively engaging with the ISHLT Registry on a partnership to pull some analyses from this, but also perhaps even revise the registry so that we can better capture this age range in terms of understanding outcomes. We also have an education and materials working group. And so this group is going to be looking at, what things already exist. So certainly partnering with Pediatric Heart Transplant Society, the Cystic Fibrosis Foundation, et cetera, to see what great work is already out there, and also kind of what is missing when it comes to patient, clinician, and family education materials. And then certainly the task force will be hosting webinars. Some that we've talked about are perhaps best practices across ISHLT. So, bringing the international community together to talk about what's working, in some places as they transition their patients. And then also, a webinar on, as pediatric conditions grow up to adult diseases. So, learning from our adult counterparts that as they're taking care of our patients in young adulthood, what education needs they have. So this would perhaps be targeted at the adult communities. And then our consensus meeting for the Transition Task Force will actually occur at ISHLT 2026 in Toronto. So this first year is really the working group, and then our consensus statement and meeting will come in the year to follow. Next slide. All right. That is not my slide, but I appreciate it. Any questions here among the group?
Melissa has to slip out a little bit early, so anyone have any questions, please unmute yourself and go ahead.
Well, go ahead.
Yeah, I can't think of a better leader and team to work on this important endeavor. And I also want to recognize and thank Simon and others who have shepherded this task force or working group through many years of planning. So thank you so much. And this is really exciting to see it come to fruition.
Put my email in the chat if anyone has any questions or follow up. And then also just to say that there's the task force is identifying a lot of work to be done in this space. And so while we have the 18-member task force, we will be engaging and reaching out to ISHLT to join other initiatives. So it will not just be the task force, for example, that does the registry work or works on an education document. All that applied for the task force, we plan to engage as our working group, develops our plans and moving forward. And so certainly those of you that have interest in these spaces, feel free to reach out. There's plenty of things to do.
Thanks so much. All right. Next, we want to talk about our thrilling upcoming webinar, The Rise of the Resistance. Leading experts from all across the globe will be discussing PVR and heart transplant and heart-lung transplantation. So hopefully this will touch on a lot of what we all do in the pediatrics professional community. We have members from all across the world joining and presenting. And so please take a second to register now while supplies last. This will be on March 11th, 2025 from 12 to 1 p.m. Eastern Time. Thanks to all who have been involved with planning this. All right. And as Dr. Bendon mentioned, there's a lot of exciting changes and emphasis in pediatrics going on with the publications affiliated with ISHLT. So the editorial board at the journal Heart-Lung Transplantation has undergone some significant changes, and Dr. Joseph Rogers is leading the charge. An exciting news, April 2025 issue will be focused on pediatric heart transplant and VAD. So these are some teasers, and many of these have not even been in press yet. So there's going to be a psychosocial paper for cardiothoracic transplant and VADs. early results of an infant model of orthotopic cardiac xenotransplant, long-term outcomes of ACHD, equity and center variation in the use of exceptions, action VAD registry 5-year experience, and also the action work in pediatric device development, and then pediatric ex vivo organ care system. So all this is super exciting, and we look forward to being highlighted in the journal Heart Lung Transplant. So please amplify this issue in all your social media and spread the word. And also Dr. Bendon and Dr. Zika are leading the special edition of the JHLT Open on pediatric thoracic transplantation. So they're currently, the authors are working on their papers, and this should be coming out hopefully in the next year or so. Is that right, Chris?
Yes. Well,
Okay.
everyone is working on it. I think a deadline is coming sooner than I want, but yes, yeah, that's happening. And I think Estella is also on the call. I think I saw at least at some point. I don't know if she wants to say anything. Estella, you want to add anything to this? Maybe she's.
Hi, everybody.
Right.
No, I'm just excited with to receive Christian and I all the manuscripts, and we hope that this will be a great edition that fellows and physicians could learn and update about the pediatric and lung transplantation topics.
This will all be open access, correct? That's really exciting. So please
Yes.
consider submitting your work to JHLT and JHLT Open. And as much as we love Zoom, I want to highlight our upcoming annual in-person meeting in Boston. So that is coming up April 27th through 30th. Please register. And I just wanted to highlight some of the agenda. This is just a snippet of some of the pediatric focused sessions. There will be tons on mechanical circulatory support, heart failure and transplant, pulmonary hypertension, and this will be multidisciplinary sessions. So we're all excited to participate.
David, I think just a quick one. I'm really excited that we managed to get IPTA on board. Before I also saw, I think, John on the call. And I think, yeah, so this is really exciting symposium. And we're doing this, as a joint symposium. And we're actually replicating the same thing then in Berlin in September when the IPTA meeting is happening. So it's really great, a great effort. It's Anne Dipshan from Toronto is moderating this one from a pediatric cardiac side, and then it's Nicholas Schrock from Hanover from the pediatric lung side. So it's once again a great pediatric heart lung effort, and then obviously bringing in other organs. As the title says, when a heart and a lung is just not enough, and it's really great. And I think we even have Lars Pape, who is a pediatric nephrologist from Germany, a former colleague of mine from old days in Hanover in the 90s. And he's the IPTA president, and he will also present, in particular, I think, on then renal challenges following, thoracic transplantation. So that's really great.
Yeah, congratulations on getting this together, John and others. This will be fantastic, and that'll be on Tuesday for your planning. And this is just a little snippet of all the exciting sessions involving pediatrics. And I also wanted to highlight our ISHLT Pediatrics reception, which I promise there will be no slides and no agenda. It'll just be networking and eating and drinking from 6 to 7 p.m. April 29th, Tuesday. There are some other sessions of importance. We should be able to, if you want to pop into one of the other professional community happy hours, and also these IDN breakfasts. So we're all part of an interdisciplinary network. So there's MCS PVD on Monday morning, and then the heart transplant and lung transplant Tuesday morning. Please make note of those. And there are some great pre-conference workshops the Saturday before the official start of the meeting. There's a joint ICHLT and ICA CTEF session. There's also a Shock Academy, a lung failure and transplant core academy, and a diversity, equity, inclusion, accessibility workshop, all on Saturday morning. So you have to just choose one. So just a quick mention about membership. Believe it or not, we are small but mighty. Almost a tenth of ISHLT members call Pediatrics their primary professional community. And Pediatrics, as Chris mentioned, is only one of a handful of groups that has consistently and significantly grown in numbers the past 4 years. So we continue to grow. Our ISHLT members, as you know, are quite diverse in where they're at in their career, where they come from, and also which interdisciplinary network they belong to. Oh, sorry, David, you had a question?
Yeah, I'm happy to wait to the end if you prefer.
Okay. We're almost done. Yeah. And then if any of you haven't renewed or joined, please, you can scan this QR code and join today. No discount though today, sorry. And just briefly, as others have mentioned, there's always exciting standards and guidelines work being done that are directly relevant to pediatrics. Please check that website or just Google standards and guidelines ISHLT. In the last year or so, recently published, there's been the evaluation and care of heart transplant candidates, and all these have sections focused in pediatrics. There's been one focused on measles, MCS hemocompatibility, MCS infections, and frailty. And even more exciting, under development and coming soon, there is a ton of work in lung. So allograft dysfunction, frailty, pathology, referral selection focused on pediatrics, and pH risk stratification, antibody-mediated rejection. And then there's pediatric heart failure update coming soon. There's one that we're all looking forward to, engagement of social support systems with respect to transplant and also palliative care. So please be on the lookout for these. And also there is a form online if you feel like these aren't reflecting the need. There's a form online where you can submit your own ideas for S&G as well. Please reach out if you have any questions about that. And then now's the time just for some discussion. We can, David has a question first, but I want you all to think about, what do you want out of ISHLT? What are some hurdles to getting more involved with ISHLT, and how can we address some of these hurdles going forward? So those are some things that we want to hear about.
Yeah, so David, a question that came to mind, especially with Christian commenting upon the success of this year's academies, and the slide you mentioned, it's been some time since we've had a pediatric MCS academy, and it's been even considerably longer than that since we've had a pediatric heart failure academy. And my suspicion is that the scheduling of these on the kind of the longer timeline is years in advance and is mapped out from one ISHLT meeting to the next. But is that something that has been discussed or has been thrown around for future meetings to be able to get back into pediatric academies or get us on the schedule?
Yeah, I just talked to Sue about a follow-up for the pediatric heart and lung transplant academy that happened last year. And so for Toronto, they were planning to do a master's academy for transplant. I'm not aware about MCS. David, do you know if there's any plan in the loop?
I think I haven't heard. I haven't been privy to the academy planning. I know it is a quite involved process where I think Ryan Butts led the helped lead the pediatric heart failure core academy, and there hasn't been an update since then. So I don't know, Christian, have you heard
No,
any
I
updates?
only have the update exactly as Simon said. So definitely there's pediatric heart lung scheduled for Toronto. But I think David, why don't you just reach out to Sue Besner and just and then maybe you could just put something through ISHC Connect afterwards, so for people just to have an update. And it's always important. Simon has been excellent over the recent years. Whenever there was any kind of document and something coming up, there was always his hand up at the board meetings. And what about pediatrics? What about pediatrics? He was really good with this kind of, making sure that our voice is heard. And I think that's very important, because, we're looking after the smallest patients, but we need to make, we need to be loud. And so maybe that would be a great idea, David, to really liaise with Sue Besner. And yeah, Juliet is just putting the email address in there. Drop her a line. She's super responsive and she'll give feedback. And then if not, then, David, if you're already volunteering or getting things sorted, we always need people. That's great.
Yeah, I'd be happy to work with the people on this call on figuring out what would make the biggest impact. I think they're all overdue.
I think Nihao has a great idea. If folks want to be involved or want to be included in that, I'd be happy to email Sue and then CC anybody that wants to be involved or on that email, and just please include your email if it's not already on the chat.
That's really the important part about the society is also meant to be one of low hierarchies and barriers. So whoever has ideas, same as everybody can submit basically a proposal for symposia and so on, whatever you come up with and think, oh, really, we haven't done this in a while, or we should have this, you can ideally approach through your representation, like David and Neha coming up and so on, but also always feel free to directly communicate to anybody you think might be the appropriate person to hear about this. And there's never, as Christian said, it's not really, there's no bad intention in ignoring pediatrics. It's really often just an oversight. People say, oh, we should do this AMR document, and they don't even think that may need a separate section for pediatrics or something like that. But then usually when it's mentioned, it's welcomed.
Yeah, I know that the amount of work that it requires and advanced planning it requires to get it accomplished is not trivial. And it wasn't a complaint necessarily as much as to make sure that there is something in the thought process of the ISHLT, and if not, happy to offer help.
Yeah, David, maybe you can plan something grand for Australia. So what are some questions? Thank you everyone for joining. Everyone's been pretty quiet. What other questions do you all have? But David, with respect to the academies, you know, they are releasing the pediatric heart failure update, so I don't know if that can easily translate to an academy as well. But definitely for heart failure, lung transplant, and also MCS, I think they all warrant some updating. All right, well, appreciate everyone's attention, and I think there's, as you heard, a lot of exciting things going on, but feel free to reach out offline if you have any questions or ideas, and happy to try to um, put them into leadership and get them going. So thank you so much.
Thanks, Dave, and everybody for coordinating this.
Thank you.